They will make differences in people's lives. It's not only a relationship of instructors to students, it's more like mentorships. That really sets us apart from other universities.
It's great to see how well prepared students are.
You cannot just attend lectures. You have, in fact, to apply what you are learning. I promise them they will have rewarding careers.
These are the competitive advantage of the faculty.
Those are one of the competitive, in fact, advantages that we do offer at AUST, at the Faculty of Health Sciences.
Hi everyone, and welcome to a new episode of Voices of Excellence live from AUST. Today I'm joined by Dr. Gretta Abou Sleymane, Dean of the Faculty of Health Sciences. We're going to talk about the different majors offered, the master's program, hands-on training, and what students should expect when it comes to the Colloquium Comprehensive Exam. So let's welcome Dr. Gretta. Good morning.
Good morning, Jessy, and thank you for having me.
Thank you for you. Can you please tell us more or to give us a quick overview of the Faculty of Health Sciences at American University of Science and Technology?
Sure. The Faculty of Health Sciences combines education, research, and community services to make people's lives better. Academically, we offer majors that are at the intersection between science and healthcare. So we graduate students who are competent and who are compassionate and who are ready to join the healthcare professional careers.
Okay, so let's move now to the majors. What are the 6 majors students can choose from the faculty?
So we offer a broad range of majors in healthcare, including clinical laboratory sciences, forensic science, optics and optometry, radiologic sciences, nursing, and nutrition and food science. So the students have the flexibility to select the major that fits best with their career's goals.
So that's a great variety of fields.
Indeed.
Which one is the best major?
That's a tricky question.
Yes.
I believe that they are all the best majors. Again, as I said earlier, when you are a health care professional, you are making people's lives better. You are making a difference in people's lives, and that's, I guess, enough. Then it depends on your personal, preferences, but overall, in my opinion, they are the best majors.
So what makes studying health sciences at AUST different from other universities?
That's a great question. I believe we are different for a number of reasons. First, we start with a foundation year through which our students explore several topics related to biology and chemistry, and they are also exposed to real-world cases in the different majors. So at the end of this first year, they can make an informed choice about the career they want to pursue.
Yes.
And this is interesting for them because if they change their mind at the end of this first year, it's perfectly fine. So for example, some students join us first and they want to become forensic scientists, and then they say, well, we want to become clinical scientists, and that's okay. And number 2, I guess that really sets us apart from other universities is how early, in fact, we integrate practical learning in our programs. In fact,
we're going to talk about the practical training and learning. Okay. So as you can see, I can say these are the competitive advantage of the faculty.
Those are one of the competitive, in fact, advantages that we do offer at AUST, at the Faculty of Health Sciences.
Now we're going to talk about the master's program. Can you tell us more about the master's program offered for the students who wants to continue their education?
Sure. So in addition to the undergraduate programs, we do have master's programs in optics and optometry, in bioanalytical toxicology, in biotechnology with 2 different tracks, one
Yes.
track in DNA technology and a second track in forensic science.
Yes.
And our students are deeply involved in all our ongoing research projects. And in this connection, I would like to insist on the fact that our research projects at AUST are always selected based on our community needs.
Yes.
For example, in human genetics, in addition to the basic research that we are doing, we are working, for example, on consanguinity, when we have marriages within the same religions or the same regions, and how this would affect paternity testing, for example.
Yes.
Or we are developing our own DNA test and toxicology tests. So we are always trying to develop our own solutions based on our own context. And this is very interesting for the graduate students at the master's levels.
Yes, doctor. It's very important to support students and to make them thinking on a long term.
Sure.
Right?
Sure. And this is why we are always working side by side, in fact, with our students, be it at the undergraduate level or the graduate level.
Yes.
So the relationship with them is not only a relationship of instructors to students, it's more like mentorships. We are mentors, in fact, and we really take this seriously, in fact.
Okay. How important is training and hands-on practice during the year of study?
It's absolutely critical, in fact. Students cannot learn health sciences or even sciences, in fact, in general, just by being in the classrooms.
Yes.
You cannot just attend lectures. You have, in fact, to apply what you are learning, what you are memorizing. And as I said earlier, this is why we have integrated lab courses and internships and practicum as early, in fact, as the first semester.
Yes.
So all our courses are associated to lab courses. Since day one, our students have their own benches, their own sets of pipettes, their own reagents in the biology lab, in the chemistry labs, etc. Then starting the second and the third year, they have their practicum courses, their internship courses. So we want them, in fact, to be exposed to real life cases.
Yes.
And basically, this makes all the difference when they graduate.
Yes, the real world practice is very, very, very important,
Definitely.
especially in the field of education.
Definitely.
Yes.
Definitely.
So, what kind of training opportunities do students get before graduation?
We offer a broad range, in fact, of training opportunities for the medical or clinical majors, such as clinical lab, nursing, nutrition, radiologic sciences. We have affiliations with the top hospitals, with private laboratories, with rehab centers. So our students have rotations, in fact, in all those centers. They are also, in fact, involved in community services. So before they graduate, they would have seen all the different sides of the healthcare system. For forensic science students, it's a little bit different. They are working with related NGOs, and they work closely with the armed forces, the Lebanese army, the general security, and most importantly, the internal security forces.
So it's great to see how well prepared students are.
They are, and this is why, in fact, our graduates are very successful in their fields, and the list of the FHS success stories, alumni success stories, is long, very long, and we're proud of this.
We're gonna move now to the Colloquium Exam. What is Colloquium Exam?
The Colloquium Exam is a comprehensive exam. It's an official exam, in fact, that is organized by the Ministry of Education and Higher Education and by the Ministry of Health. In fact, it's an exam that will test the students to make sure that they know everything that they've learned at the theoretical level and at the practical level, and in challenging, in fact, clinical situations. So basically, it's addressed to all students who are graduating from private universities in Lebanon, or even students who are, in fact, graduating from any university outside the country. And it's, in fact, ensuring that students can pass from the student status to the healthcare professional status.
So, Doctor, how does AUST support students in preparing for the Colloquium exam?
Well, when we have disruptions of the learning process, for example, during the pandemic or in war situations, we do offer review sessions and practical exams to help our students prepare for the colloquium exam. But in general, we are preparing our students throughout their BS. We do not wait until the senior year to prepare them for the exam. And as I always tell my students, you have to enjoy, in fact, your BS and to study on a regular basis, on a daily basis. And indeed, we are very happy and proud of the results of our students. So if we consider all the majors where we have a colloquium exam, a clinical lab science, nutrition, nursing, and optics and optometry, overall, the success rate is between 95 to 100%, which is excellent. And the next round of colloquium is scheduled in July, and we're looking forward to 100%.
So, Doctor, before we wrap up, for students interested in joining the Faculty of Health Sciences, what advice would you give them?
If they are interested in joining the Faculty of Health Sciences, this means that they like sciences, they like healthcare professions. I'm proud of them first. I would highly encourage them to join our majors. Again, they will make differences in people's lives and will be helping them to succeed in their careers. And I promise them they will have rewarding careers. And we're waiting for them.
Thank you, Dr. Gretta.
Thank you, Jessy.
Thank you so much for sharing this valuable information. And it's clear that the Faculty of Health Sciences is building the next generation of healthcare professionals with real knowledge, training, and passion. Thank you so much.
Thank you.
And stay tuned for the next week with more topics.